Changes we're experiencing and those that loom on the horizon in the economy and healthcare delivery and government, donor scrutiny, and the ways and means of philanthropy and fundraising can seem overwhelming. Now, it's not all that sets the stage, but in fact, in the midst of all this uncertainty, there are four things that I believe are certain in what we're facing. First, change is occurring, and the philanthropy landscape will be altered with that change. AHP needs to take the lead and the high ground in managing, speaking up to what that change should be, how it relates and impacts philanthropy. Number two, no matter what the landscape appears to be in the future, philanthropy will continue to play an integral role in healthcare delivery. It's not going to go away. We need to communicate that. Thirdly, we as leaders in healthcare philanthropy must define, articulate, and direct the change. Define, articulate, and direct the change that will strengthen the institutions we support and the communities that we serve. And that becomes a clear mission for us, an activity that we have to follow. The fourth thing is that AHP, your association, is the association to lead you in this new arena, this new era of healthcare philanthropy. We have to be future-focused, focused on the large issues, the issues that are related to the sector and to the profession. It's not going to matter to us some of the things that we deliver all the time on an ongoing basis. It does, but the real important ones happen to be those standards. It happens to be our ability to play a meaningful role in defining the change that's important for us. All right, how are you holding up? Everybody all right? Good. Now, we know we can't go alone, and you've probably heard some of this all together. We've formed coalitions like you can't believe, many of which we've had and we've dealt with and we've tinkered with over the years, but since January, we have kicked them up. We've accelerated. We're in a hot car right now, and it changes all the time. But we have developed strategic alliances with partners like the American Hospital Association. There are a lot of issues we won't support with them or get into, but they are supporting ours and helping to communicate many of ours. And we help theirs too, but on a selective basis. But the American Hospital Association, the American College of Healthcare Executives, Healthcare Financial Management Association, those CFOs, the Catholic Health Association, particularly as it relates to community benefit and what they've done there and what our board of directors embrace and endorse. Imagine Canada and many others, independent sector. Imagine Canada we're meeting with on October 7th. We want to find out how is it that we can team with them and join and support the kinds of things that are important to our Canadian members. We have also united to educate and persuade lawmakers and government officials about the issues that are important to us on both sides of the border. We'll continue to voice our concerns regarding tax policy, privacy policy, status of not-for-profit eligibility. Also, we've taken steps to mitigate some of the uncertainties that result from the economic downturn by providing useful information and expertise, by surveying our members and developing and communicating the kinds of things that they've done to counter the effects of this economy and the scrutiny that we're facing. We've used meetings, virtual conferences, publications, phone calls, conference calls, just to determine what works and communicate what is working best in some of these situations. Our members have been vital to us in enabling us to develop what's best to share and what works in this kind of environment. Additionally, our 18-month expensive effort to build a platform for our website to deliver these kinds of things in unique ways has come to fruition. Another thing AHP has done, and we've put a concerted effort together, is to really work with hospital CEOs and bring them into our circle of information and how we have that flowing. We've done a lot to stress the importance of philanthropy to them. Our goal of getting 30% or 50% of CEOs to have accountability in philanthropy in their job description and even their compensation, we're up around 35% in that effort. That's a wonderful thing. Well, there you go, Sue. You know how it is. We're also excited to be able to distribute to AHP members, and it's up on the web, an important new trends report that I believe warrants your time, attention, imagination. It's one element in an attempt to we undertook last autumn to get a handle on the interaction between the changes in healthcare, changes in philanthropy that we're facing. Finally, we've studied what the confluence of these trends will mean to all of us, the profession, the institutions where we labor. And one of the overwhelming conclusions, and there are 5 or 6 major ones, but one is that, and a thing that's evolving is our need to rethink to redefine our roles as executives in philanthropy and in the healthcare environment, in the hospital, wherever you happen to be working, in the delivery system environment. We need to become more of the executives that are looked upon as organizations, activities that can contribute to the future and the ongoing support of our hospital. So I want to tell you, if the question for you is when will things get back to normal, I have news for you, whether you tweeter or Twitter. This current atmosphere is the new normal. This change element that we're facing is the new normal. The ambiguity, the uncertainty is going to be at various levels on different days, and we've got to learn to deal with it and address it. These changes are impacting philanthropy and our concept of stewardship. There's no question about that. We're finding that we're going to have to engage our most creative talents and individuals to find and implement new ways to relate to donors, the leadership of the healthcare community, the needs of the global community as well. It's all part of what we're facing. So, how can we live that dream? Well, the simple and complex answer is we have to build that dream ourselves. We have to do it individually. We have to do it together. The future of our communities depend on our dedication, our enthusiastic vision for the future, our donors' future, our patients' future, and the people we serve. I can tell you in my mind, ladies and gentlemen, it's time to be bold. It's time to take charge of the wave of change as it is facing us right now. It's time for you and AHP to fashion and to lead this change. I'm reminded, I have a famous quote on my wall in the office that's something like this: the ultimate measure of an individual is not where he or she stands in moments of comfort and convenience, but where they stand at times of challenge and controversy. And that's why we need to step up and we need to address these issues. It's my fondest hope that you will engage and join me and your AHP leadership in molding this dream we are living. So join us in molding this dream we are living.